Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today's topic has to do with goiter and diabetes. When we talk about goiter, it's like talking about the thyroid disorder. And goiter is usually formed based on the lack of iodine, which has been corrected in many places with putting iodine in the water or the food we eat, because iodine cannot be provided by the body itself. It has to come from outside. So it's what we drink or eat that contains iodine that provides this necessary iodine for the thyroid gland to produce the various thyroid hormones that really, if iodine is lacking, will now cause the thyroid gland to expand. But it's not in all cases that this thyroid gland will now expand. It could also be as a result of immunity or nodules or thyroiditis and even grave disease. These are all things that I shall expose. But what we have found is that there is a link between the thyroid problem, thyroid disorder, and diabetes. The Danish researchers have found that a long time ago, and more research work has still been done, that it's as if the thyroid disorder or goiter that you probably understand is as could lead one to being diabetic. So should there be a situation of a problem with gland that is so concerned with the production of the glucose in itself, making it available all over the body, then there is a problem that could affect glucose. Even the results you get on the values, that is the quantity of these hormones, these thyroid gland hormones, when a woman is pregnant, reflects that they play a very big role in metabolism, because the values of babies' thyroid hormones T3 and T4, they are higher than what even an adult would have as its normal value. They have almost 10. It is a known fact that thyroid hormones affect glucose homeostasis. Homeostasis in the sense that the glucose level is supposed to be controlled. When it is high, there is the need for the liver to convert it to glycogen. And when it is too low, there is a need for the liver to convert the glycogen to glucose. So that homeostasis could be affected by hyperthyroidism or hypothyroidism, and that is what I shall expose more in the slide section. So join me as we move on to the slide section to look at how we can also help ourselves from suffering these two conditions, thyroid disorder and diabetes. The outline: objective, introduction, area of interference, lab diagnosis, and finally remedy. The objective: to expose the detrimental effect of thyrotoxicosis on glucose homeostasis and how it can be monitored with laboratory investigations to remedy the condition. The introduction: the thyroid gland is located in the neck region on top of the trachea and larynx, like a coverlet. Its chief function is to maintain a higher rate of metabolism, as evidenced by heat production, than would otherwise be possible, and to regulate these rates according to the needs of the body using the iodine-containing hormones, thyroxine and triiodothyronine, also called T4 and T3 respectively. Evidence for a relationship between T4 and T3 and glucose metabolism appeared over 100 years ago when the influence of thyroid hormone excess in the deterioration of glucose metabolism was first noticed. The effect of T4 and T3 have a large impact on glucose homeostasis. This concept was acknowledged by Nobel Prize winner Dr. Bernardo Alberto Osei in his lecture in 1947. Overt hyperthyroidism has been related to glucose intolerance and even ketoacidosis. With regards to hypothyroidism, cases of hypoglycemia have been reported in the literature, despite the fact that peripheral insulin resistance may be present. The implications and consequences are enormous. You could talk of cretinism, we can talk of Graves' disease, we can talk of Hashimoto, thyroid, diabetes, and all these formation because the thyroid gland is involved in all metabolic processes. Areas of interference. Diabetes mellitus is a metabolic disorder, and thyroid hormone disorder is a disorder of metabolism. So without much ado, one can hazard the guess that they must affect each other. We know that the regulator will always regulate. The regulator thyroid hormone in this sense regulates glucose in these four or more organs: the liver, the pancreas, intestine, the skeletal muscle, the peripheral blood, the brain, name them, as depicted in the diagram that follows. The diagram shows clearly the connection and the importance of thyroid hormone. It is the thyroid gland is the central figure there, where the thyroid hormones come from. It affects the liver by making sure that the glycolysis activity is increased. You can imagine the energy that will be produced from the glucose breakdown, increase glyconeogenesis, increase glycogenolysis, and also increase hepatic glucose output. In the process, the peripheral insulin resistance comes up because the level of glucose is now very high. It also affects the lipids, increased lipolysis, whereby more fatty acids are produced, increased serum fatty acid, thereby also the skeletal muscle is also affected, increased glucose uptake of the skeletal muscles. It also affects the pancreas, increased beta cell development and function, stimulate insulin secretion, and that means more glucose in the system, and the insulin could also result in insulin resistance when it's just too much. Then increased glucagon secretion, that would affect the storage of the excess glucose as well. So it's very effective. It also helps with the increased gastrointestinal motility, therefore enhanced glucose absorption. So, but you can then understand when it is hyperthyroidism working in excess. The net activity of this diagram is that once it's overreactive, there is a serious problem, because thyroid hormone play a role in the development and differentiation of pancreatic cells, including alpha and beta cells, as we see in that diagram. Specifically, thyroid hormone can influence the expression of genes from ab initio like PAC6B and MNX1, which are involved in beta cells development, while also affecting the expression of genes like ANX that are important for alpha cells development. These are genes that are responsible for the glucose homeostasis. So if it can affect them and is now produced in large number, it's like what a cancer cells overreactive would do, overactive. That implies that it affects glucose homeostasis, both insulin that allow glucose absorption and glucagon that store glucose as glycogen in the liver. Because babies need much metabolism to build the body in pregnancy, like estrogen level increase and thyroid binding globular concentration rise, which leads to an increase in T4 and T3 in the first trimester of babies. Serum TSH, which is thyroid stimulating hormone, also falls due to the effect on hemoglobin, which may be associated with a slight and transient increase in T4. Yes, laboratory diagnosis. Currently, screening for thyroid dysfunction is recommended in children, adolescents, and adults with type 1 diabetes mellitus by the American Typhoid Association, the British Typhoid Association, the American Diabetes Association, the American Association of Clinical Endocrinologists, National Institute for Health and Care Excellence, and the International Society for Pediatrics and Adolescent Diabetes, but not by the United States Preventive Service Task Force. Thyroid gland function test is shown in the diagram that is shown there. One could also include the ESR, and for thyroiditis, you could do culture where you are expecting staph aureus and strep pneumonia, or amongst all the other organisms that are resident in that area and could affect the thyroid gland. Glucose tolerance test for diabetes, fasting blood sugar, 2 hours postprandial, hemoglobin glycated hemoglobin tests are useful to confirm diabetes mellitus. Finally, the remedy. The remedy is to perform screening tests on people who are likely to experience thyroid disorder. Age is very indicative because it's a screening test for people who are over 30 years. And currently, those who are receiving levothyroxine replacement, history of hyperthyroid or hypothyroid disease, postpartum thyroiditis or thyroid lobotomy, family history of disease, goiter, thyroid. These are all treatment. Infants with abnormal screening tests should receive confirmatory testing and begin appropriate treatment with thyroid hormone replacement within 2 weeks after birth, because you need all these. The child might be affected mentally. It causes mental retardation, the stunted growth, dwarfism, and so much. So it's very important that we take note of all these implications. Yes, additionally, it has been known that hyperthyroidism is associated with insulin resistance. More recently, hypothyroidism has also been linked to decreased insulin sensitivity. The explanation to this apparent paradox may lie in the differential effect of thyroid hormones at the liver and peripheral tissue level. These are what we should not play with, especially when we are talking of pregnant women. Care should be taken so that the formed children will not be. As usual, I urge you to watch more of these videos in my channel, and you'll get more enlightened. Just click the subscribe button for more.